In my time here, I've worked on medical research, getting funding for that, and other pieces of legislation that are particularly important. The Lymphedema Treatment Act is one of them. Childhood Cancer STAR Act is another. Anytime a parent comes in advocating on behalf of their child, it's a memorable experience. You guys do all the work. The advocates come in, they put together the pamphlets, they spill their hearts, and all I do is try and figure out how we can best help them. Anytime that I can have a positive impact on that, I want to do my best for those folks.
Even though rare diseases by nature are rare, there are so many different rare diseases, and it really affects millions of Americans. It's really not rare to know someone, whether it's someone in your family or a family friend who's impacted by a rare disease, and the policies have to be slightly different because there are smaller individual patient populations. One of the biggest things that I've been able to accomplish for the rare disease community and feel really proud of that work is 21st Century Cures, which we passed back in December, as well as the FDA Reauthorization Act, which we passed in August. When you pass a piece of legislation, it's just words on a page. And then when you finally kind of see those words on the page come to life is a really rewarding moment.
I work for Senator Orrin Hatch. I have worked with him on a number of legislative proposals, including the rare disease components of 21st Century Cures, language within the FDA user fee reauthorization in 2017. I've worked with the Senator especially on the Open Act, which remains a huge priority. There are very few champions of the rare disease community in the sense that they are there to really understand what those families are going through. Personally, being able to spread the message of what the rare disease community is actually trying to achieve, that's been very rewarding for me.
Since starting this job and work on this caucus, I've come to have a great many deal of friends and people I've become close to who have been affected and through my job. And you know, it's the time where, you know, my personal life is kind of blended with my work life. Hearing directly from testimonials and stories from patients and their families is really powerful, and it really makes a difference up here on Capitol Hill. You know, the most fulfilling part of my job is helping the rare disease community and actually getting pieces of legislation passed and signed into law.
I started right after 21st Century Cures passed the House of Representatives for the first time, and so I was really responsible for negotiating it with the Senate and continuing negotiations in the House. I think, especially in the case of rare disease, we want to make sure that we're listening to these patient voices, because it's not always possible to do the sort of gold standard randomized clinical trial. And so we need to think outside the box and look at things like adaptive clinical trials, look at how we can use biomarkers, look at how we can use patient experience and your voices and incorporate that into the review process. There's so many people counting on us to fill the gaps and streamline these processes at FDA and NIH to make sure that they can get the treatments that they need. And so there were just so many moments that really, you know, I'll never forget and will inspire me, you know, as I look back on that really, really positive time in my career on Capitol Hill.